everyone. I'm happy to be here talking today about self-compassion in the context of chronic pain. This is a topic that I'm really passionate about. I do a lot of work with this in research, but also in regards to my clinical work. And so I am excited to chat about it. A little bit first about me. There we go. So I'm a research and clinical postdoc fellow, like Dr. Jones said. I do primarily research with Drs. Beth Darnall and Sean Mackey here at Stanford, but I also work a day a week in the Stanford Pain Management Clinic with Dr. Heather Poupore-King, who invited me to speak today. Thank you, Dr. Heather King. And prior to coming to Stanford, I had experiences in a number of different community mental health care settings, including the VA in rural healthcare settings. And I've worked with patients on a number of different presenting concerns, primarily chronic pain, but certainly opioid misuse and substance use, spinal cord injury, TBI, stroke, anxiety, depression, trauma, and PTSD. And self-compassion is something that I work with almost everyone that I see clinically. And I'll talk a little bit today about why and why it's so important across a range of issues, but I'll also focus today on why it's relevant in chronic pain. I'm also funded by the NIDA Pain and Substance Use T32, the National Institute of Drug Abuse, and that's funded under Dr. Sean Mackey. And I'll start today by talking actually about a recent setback that I experienced pretty recently. So growing up, I was a really active kid. I was in sports. I played collegiate volleyball. After volleyball, or after college, I engaged in a lot of physical activities and team sports. But when the pandemic hit, that kind of went by the wayside. And so I started hiking more. But this last July, I actually had an injury while hiking. I hurt my knee pretty bad. I had to really, impaired my walking. I wasn't able to do much kind of physical activity. And it came at actually a pretty awful time. It was right before I was going to move down here to California. I was going to take about a month or a month and a half off of work to relax and explore California and just get a sense for the place that I was in and relax. And this knee injury really threw a wrench in that. It really came at quite a tough time. I had to, rely on others to help get through the move. And what I thought to be was going to be a really fun and relaxation-filled vacation was actually me sitting at home, kind of caring for my knee. During this time, I had lots of, critical and negative thoughts. Oftentimes I would think, this is your fault. Why were you being so careless? You're so lazy and useless. You just get over this. Lots of thoughts and shame and anger and frustration. This led to more inactivity and isolation, and really, took a toll on me and kind of threw me for a loop. And I share this story with you all just to kind of maybe demonstrate that hardships are tough. And so I'm actually going to ask you to take a moment to think about a recent hardship that you experienced as well. And think about maybe how you talk to yourself in those moments. What sorts of thoughts were running through your head? What maybe sorts of emotions were coming up? And I wonder if maybe you might have experienced something similar to me, a lot of negative emotions, a lot of negative self-critical talk. Maybe some of these words floated through your mind: not good enough, I'm a failure, worthless, useless, pain, certainly. And unfortunately, this is a really pervasive response to setbacks, to failures, to difficult experiences in our culture. To self-criticize, to get down on ourselves. And I'll talk a little bit about why this is our response to setbacks and failures. And I'll also talk a little bit about how we can counteract these things and why this is so important in chronic pain specifically. And so I'll start by talking a little bit about self-worth, a little bit around how is self-worth determined, particularly in our culture. And maybe even by saying that word, you might even have a reaction now of, oof, self-worth. That is a common word in our culture, and it's often based on a couple of different things, at least in our American culture. Oftentimes, it is seen as conditional, meaning there are prerequisites. I'm worthy if, fill in the blank. For us in American culture, this often means a focus on productivity. How much are you able to produce, achievements? This can also mean social status and money. How much money do you have? How much power? What's your job title? There's also a specific focus on physical attributes. This can be like color of your skin, the color of your hair, the size of your body. All of these things can create prerequisites. And it's specifically in American culture as well, is this focus on individuality, this focus on pull yourself up by your bootstraps, a focus on being able to do things on your own, a focus on being able to be special, unique in something. And you might notice all of these things sort of engender or encourage us to engage in social comparison. The only way we can sort of understand if we're meeting or exceeding a specific standard is by comparing ourselves to others. How much money am I making in comparison to someone else? What do I look like in comparison to someone else? And we can also determine self-worth based on how others' approval. So, you know, I immediately think of social media, right? This is such an easy way. We get likes, we get retweeted, we get comments, and that is such an easy way to determine our self-worth, right? And how much are we being seen and approved by others. All of these values that I kind of discussed are learned and reinforced through a number of different outlets. Certainly the media, this can also be our family, our friends, our schools, our work. We are constantly in an area in which we need to determine how am I compared to others? How am I being better than others? And this can lead us on this hamster wheel of never feeling good enough. Right? There's always someone making more. There's always someone achieving more. There's always someone who looks better or has more status. And it can really lead to a pervasive kind of need to feel like I need to kind of tick these boxes in order to feel worthy, in order to feel like I have value. And you can imagine, right, that this then leads to negative self-critical talk. It can lead to certainly negative emotions. And, you know, that is just kind of at a baseline. And then we add in chronic pain. 1 in 4 adults have chronic pain. I'm just going to let that sit for a moment. It's a pretty staggering number. About 25%, I've seen even estimates upwards of 30 or 35% of the US population has chronic pain. So this too is something that a lot of people struggle with. And it can cause significant disruption to daily life. And I know I don't have to tell you all this, but it can impact our mood, our sleep, our relationships with other people. It can make just carrying out daily activities harder. It can certainly impact the way that we engage in work and do hobbies. It can reduce physical activity, produce different changes in the body. And it can increase our need to rely on other people around us. And so you can imagine in a world where our self-worth is seen as contingent and that we have all these prerequisites, that chronic pain makes that harder. Pain can also activate our stress response in our body. Pain is closely linked to our central nervous system. It can activate quite easily. You know, we have increased stress. This might mean increased cortisol into the blood. It might activate that fight or flight response, and which is going to increase pain and make us more sensitive to pain. And there's actually a recent study that found that self-criticism or negative self-talk also can activate the stress response. There was an imaging study actually that showed that when we are engaging in self-criticism or engaging in negative self-talk, This actually activates parts of the brain associated with perceiving threat. And now this is really adaptive when there actually is a threat, right? If someone's coming after us or we need to get to safety, activating that stress response is good. It gets us to safety, keeps us safe. But when this is activated all the time, and especially when we have pain, and especially in the context of self-criticism and negative self-talk, this contributes to more stress and more pain over time. And so I'm going to talk a little bit about self-compassion and really how self-compassion can be used to help get us out of this negative cycle that we can find ourselves in, both on a physical level and counteracting that stress response and pain, but also that negative self-talk and that conditional self-worth. And so in order to engage in self-compassion work, there are 3 important tenets or assumptions of this work. So the first is that pain, suffering, setbacks, and failures are common and normal. That all of us, I know I can't see you all, but my guess is that if I asked you if you've had any of these things, pain, suffering, setbacks, or failures in the last week, month, maybe couple of months, that all of you would be raising your hand. These experiences are normal, even though our culture perpetuates this notion that they're not, that we should always be striving to be better, that we should not be experiencing these things, when in fact, they're pervasive also. Another tenet of self-compassion is that difficult experiences are unavoidable and part of being human. That these difficult experiences can kind of run the gamut of pain, difficult emotions, maybe grief or loss, difficult circumstances, a difficult environment that you maybe grew up in at home, that all of these things are things that we did not ask for, and that are part of being human, unfortunately, and that this is not something that we can outrun. And the last important tenet of self-compassion is that each person, including yourself on this call, is worthy of compassion, respect, and forgiveness. And I'm going to let that one sit for a moment, because it's not something that we hear every day, and certainly is not embedded in the messages we receive in media and in our broader culture. That each person, is worthy of compassion, respect, and forgiveness. And this is, as you can see, flies in the face of the conditional self-worth that maybe we've been taught or brought up in our American culture. And so self-compassion, it was developed by Dr. Kristin Neff, who's pictured here. She really brought it into the westernized US vernacular in psychological research in 2003. But the concept of self-compassion actually has been around for thousands and thousands of years, more in Buddhist religion, and has roots in there. So it's been around for quite a long time, but it really has been brought kind of into the common literature more recently by Dr. Kristin Neff. And what it entails is 3 components. The first is mindfulness, which means bringing a non-judgmental awareness of the present moment. And so that means being present in the moment, and this non-judgmental piece can be quite difficult. It's not assigning good or bad, or right or wrong. It just is. And this is really important and sort of a foundational component to self-compassion. Next is self-kindness, which is bringing a kind and understanding stance towards ourselves. And then lastly is this sense of common humanity, which means seeing our experience as a common human experience, not seeing it as unique or special to us, but that rather this is something that loads of people experience and is a common experience. And so I'll talk a little bit about what this actually looks like in practice. So thinking back to my recent setback I talked about, where I had my knee injury while hiking, bringing a bit of mindfulness to that situation, I might notice in the present moment that I'm hurting both physically and emotionally. I'm frustrated with the circumstances and I'm sad that this happened. I had plans to relax and do a lot more with my time, but this knee injury really kind of threw a wrench in that. So really noticing kind of what I'm feeling in that moment. And then bringing a bit of self-kindness towards myself. How would I be kind of empathic or compassionate towards myself? I might say something like, this is a really difficult situation that's taken a toll on me, but that's okay. If it feels genuine, you might say something too that like, this is really tough, but I'm going to get through it. And then lastly, for the common humanity piece, I might say something like, others experience exactly the same thing, right? Others experience setbacks like this too. It's normal to feel this way. And so why might this compassionate or self-compassionate responding, why might we do this? Why is it important? Well, there was a recent study that actually, that same brain imaging study that I mentioned before, asked folks to come in, stick them in an MRI machine, scan their brains while they're practicing self-compassion and while they're engaging in negative self-critical talk. And they do that 2 weeks, first at the pre-treatment and then post-treatment. And through 2 weeks, they ask them to practice some self-compassion responding towards themselves. And what they found is that over 2 weeks, the people were able to evidence reduced brain activation in areas associated with perceiving threat. So they're able actually to reduce the amount of reactivity that they were having. And this was evidenced by physiological markers as well. So they had the galvanized stressed skin response, so how much were they sweating, like maybe on their hands, and then their heart rate variability. And they found that after 2 weeks of just practicing self-compassion, they were able to have reduced physiological markers of that stress response. And in addition, they were actually showing increased physiological markers associated with the relaxation response. So again, reduced heart rate, none of the fight or flight response, maybe decreased muscle tension. And then they looked at individual effects too, and they found that folks who practiced this more over that 2-week period had stronger effects. And so what this says is that even after just 2 weeks of practicing this self-compassionate responding, they were actually able to reverse that stress response and that reactivity, which is pretty remarkable for that short period of time. And then among people with a wide range of chronic medical conditions, higher self-compassion has also been associated with improved depression, anxiety, quality of life, stress, physical health, social connection, and even an improved immune response as well. So again, kind of bringing support that this is not only a effective psychological response, but also can have physical impacts on our body. And among those with chronic pain specifically, higher self-compassion is associated with improved pain intensity, pain interference, or how much pain gets in the way of activity engagement, pain-related fear, and can even help quell negative pain thoughts. And so there was a study that I was involved with a few years back that really wanted to disentangle a bit more of the self-compassion responses among folks with chronic pain. And so we looked at what was the role of self-compassion among a number of different functional outcomes. And we found that self-compassion had stronger effects on those, on responses to pain, which can be symptoms of depression, psychological functioning, pain acceptance, pain-related fear, and engagement in valued activities. And it had smaller effects, although still had effects, but had smaller effects on pain intensity and physical disability. And I'll talk a little bit about why we might see this difference. Why is self-compassion have stronger effects on these responses to pain than pain itself? And one way to think about this is the idea between primary suffering and secondary suffering. This is a concept that's, again, linked to kind of the Buddhist traditions, but we can think about our experience in two different pieces. There is our primary experience, which is whatever is actually going on in the present moment. So for example, let's say I'm walking around the house and I stub my toe. My primary experience of that is going to be pain in my toe. Maybe even the pain reverberates up my legs and into the rest of my body. Maybe it's increased heart rate, surprise. Maybe there's, some thoughts running through my head, like what's happening? Well, how did this happen? And then there is our secondary experience or our reaction to that. So in the context of me stubbing my toe, it might be all these things we lay on top of that. So I'm so stupid. Why didn't I see that? Who put that there? That's been changed. You can see that the pain then goes maybe from here and it just kind of ripples out and ripples out. And we can have kind of reaction on top of reaction. And what self-compassion really does is help get us to notice our primary experience, what's actually going on in the moment. So maybe noticing my toe hurts, maybe there's some anger or frustration and other thoughts floating through my head, but then can help quell or reduce those secondary reactions. It allows me to maybe better respond to the situation. Maybe instead of getting angry or frustrated, I'm able to say, wow, that came out of nowhere. I didn't see that. Maybe I'll take a break and make sure my toe's okay. For folks with chronic pain, this can look similar, right? Primary experience might be that you're feeling pain. Maybe it's in your lower back, runs down your legs. Emotions might be fear, anger, frustration. You notice thoughts running through your head, but then we can react, maybe ineffectively to pain. Maybe that might cause us to reduce physical activity for prolonged amounts of time. Maybe we can get caught in kind of ruminative or depressive episodes, and it can kind of go from there. And what self-compassion can do is sort of validate our primary experience, what's actually going on, and then allow us to effectively respond to what's going on because we're able to acknowledge it, not push it to the side, not ignore it, or blow it out of proportion, right? We're able to be with what's going on in that moment and respond kindly to ourselves and more effectively. And so we can reduce the impact of how pain and other really suffering, trauma, grief has on our life. And so when I talk about self-compassion with folks, there are a number of reactions to it. And so I'll kind of walk through a couple of them that I see commonly. Oftentimes people might see self-compassion as maybe a weakness, being selfish, maybe wallowing, making excuses, falsely praising myself. And a common one that comes up as well is complacency, meaning if I'm kind to myself, how am I going to motivate myself to do things? If I'm always kind of on my back, if I take the foot off the gas pedal, let's say, what's going to happen? And so I'll walk through some of these kind of myths of self-compassion and really make the case that self-compassion is actually a key ingredient in building resilience. And is actually quite the opposite of a lot of these words here. Okay, and so first myth busting here. So for folks who maybe said, gosh, if I'm compassionate myself, might that be like selfish or like self-pity? Self-compassion is actually quite the opposite. Self-compassion allows us to create a balanced view of ourselves and the situation. So again, if we think about self-pity, that's maybe being ruminative or really in our emotions and really focused on ourselves. And what self-compassion allows us to do is identify and acknowledge what's going on, but keep a healthy distance from that without maybe over-identifying and kind of quelling that secondary suffering responses by, again, treating ourselves kindly, but responding more effectively to the situation. And self-compassion can actually take a huge amount of strength. So being vulnerable, noticing difficult emotions, allowing ourselves to feel difficult emotions is actually quite hard. Um, Feeling those things, feeling sadness, feeling grief, feeling pain hurts. And it's not comfortable. It's quite uncomfortable. And so it takes a lot of strength and courage to be able to be with ourselves and those emotions and in those feelings. But when we're able to acknowledge those things and not avoid and not push them to the side, we're actually able to recover faster and adjust faster as well to new situations. Again, because we're able to acknowledge what's actually going on, being with those emotions, we can then identify what is it that I really need right now. If we're pretending like everything's fine and just barreling on, we're not actually able to effectively respond to what's actually going on. And so, like I said, it takes an incredible amount of strength to do this work as well. And then for those who maybe thought, gosh, if I'm kind to myself, how am I going to motivate myself to do things? If I take my foot off that gas pedal, what's going to happen? And self-compassion work can actually might seem counterintuitive, but can counteract complacency. Those who practice self-compassion are actually able to better identify their strengths and weaknesses. They're able to, instead of avoid and pretend like everything's fine, they're able to say, hey, I have, there's a struggle here. I'm not doing so well in this area. It can actually encourage faster growth. Another way to think about this as well is oftentimes we motivate ourselves through fear. If I don't get this deadline met, I might lose my job. That's really scary. So we rush to get that project in on its deadline. And yes, it's effective in the short term, but you can imagine if you're in a state of chronic fear, which is activating that stress response, you're perceiving threats all the time, that leads to burnout. And that can not be sustainable. And so identifying what it is that your intentions are and how behavior is being driven can actually lead us to say, oh, I'm actually interested in this work. It's not that, I'm being driven by fear, but that when we're able to develop an interest or curiosity in things and see things as they are, we're actually able to sustain that interest much longer than if we were to be driven by fear instead. And then on the topic of burnout as well, self-compassion can actually prevent burnout and actually increases our ability to care for others. So for folks who said, gosh, self-compassion might feel a little selfish and might feel a little self-indulgent, it's taking time away from others that need me. What we have found is that folks who practice self-compassion actually have a much increased ability to care for others. And we can think about that as if you have an empty cup, you're not going to be able to give much to other people. But if you have a full cup and have lots of resources, you're much able to meet the needs of those around you. And so self-compassion can help replenish, prevent that burnout, and increase ability to care for those around you. And so now thinking about starting your own journey, thinking about, I'd like to start a self-compassion practice. This is really important to me. There are a few areas in which I typically recommend folks to start. The first is beginning a mindfulness practice. Like I said earlier, this is mindfulness is a big component of self-compassion. And being non-judgmental is something that is quite difficult, and it's a state of awareness and a state of being that we're not taught. We're not taught usually how to be mindful or how to be in the present moment. We're taught to problem solve. We're taught to get out of things quickly and to fix it and move on. That's typically the messages we get. And a mindfulness practice is asking you to counteract that. It's asking you to just notice what's going on in the present moment, not labeling good or bad or right or wrong, but just noticing what's happening because it's happening. It is what it is. And for folks interested in starting a mindfulness practice, I really recommend starting small here. I don't expect you to go home and sit down for 20 minutes after this talk, but starting small, and that can mean, usually 1 to 5 minutes is where I ask folks to start. And I'll talk a little bit at the end on some apps and different websites you might check out to start a mindfulness practice, but definitely start small. And identify intentions. What are you doing and why? And beginning to identify again, what is driving, right? Is fear taking over, telling you, gosh, you better get this done or something bad's going to happen? Or can we switch that to be a little bit more sustainable? Might there be something that interests you that is a little bit more love-filled in that? You're really interested in the type of work that you do, and that is really developing a curiosity around that. Again, this is in the attempt to prevent burnout. Allowing yourself time and space to experience difficult emotions. This can go hand in hand with a mindfulness practice, but this can also look like journaling, talking to a trusted person, by allowing yourself this time and space to feel these things. You're acknowledging what's going on in the present moment, and you're really giving yourself a chance to respond effectively to the situation and to what's going on. And I often ask folks to resist the urge to minimize, right? Resist the urge to say, gosh, this is fine, it's not a big deal. To really let yourself explore, like, is this a big deal for me? What's actually going on? And practice some self-compassionate talk. A good starting place for this is to think about how you would talk to a loved one in the particular situation that you're in. Thinking about maybe a parent or friend or child. How might I talk to this person who's experiencing what I'm experiencing? And then using those same words or phrases on yourself, again, to help activate that relaxation response and to counteract that brain activation and that stress response that comes along with that negative critical talk. And also make time to recharge. And I know this is difficult, but as best you can, finding some pleasurable, soothing activities and trying to integrate them on a regular basis as best you can. I know our world is pretty topsy-turvy right now with COVID, and things are changing, frequently, but this doesn't have to be, a big, like, go get your nails done or, go to the spa, but it can be even something small, taking 5 or 10 minutes for yourself to read a book that you've been putting off that you really enjoy. Maybe it's taking a warm bath, or finding, again, just something that is going to bring a little bit of peace, a little bit of calmness. And, I realize too that sometimes that's not always possible. And so on the days or weeks that that's not possible, being able to find some moments, I say, kind of on the job to recharge. And I'll talk a little bit about the self-compassion break, which is, we'll practice that today as a skill you can use to practice self-compassion when you're in the middle of things, or things are kind of hectic and you don't really have the time to step away from the situation. And then lastly, supportive touch. And so what this means is even giving yourself just a caring touch. Maybe this might be rubbing your arm, kind of maybe hugging yourself, placing a hand on your heart or belly if that feels comfortable during times of stress, can actually help activate a soothing relaxation response. Our skin is the biggest organ in our body, and by doing this, they found that you can actually activate some of that relaxation response by giving yourself a bit of kindness in that way. And so we have a few minutes here, and so I'm going to invite you to practice a couple of skills with me if you're willing. The first one, like I was saying, is the self-compassion break. And so what I'll ask you to do is think of a situation in your life that is difficult or causing you stress. And when I say this, I mean, so on a scale of 0 to 10, 0 being no stress at all, to 10, like crazy amount of stress. If I think about it, I feel overwhelmed. Pick like a 3 or 4, something that you can think about that isn't going to send you over the edge. That's maybe a minor annoyance or a slight setback. So call that situation to mind. And you might even close your eyes if you're willing. And just noticing, even as you're calling that situation to mind, what you're feeling in your body. Maybe there's already a stress response or pain. Maybe there's an emotion present. Maybe thoughts are racing or there's no thoughts at all. And what I'll ask you to do here in the self-compassion break is to just identify what you're feeling and thinking. All you have to do is label. Maybe label anxiety, maybe butterflies in my stomach, maybe my thoughts are racing. And next, if you're willing, just repeating a phrase. I'm not alone. We all struggle. Or something to that effect if that doesn't feel genuine. Not alone. We all struggle. And next, I'll ask you, what is it that you really need right now? How can I be kind to myself right now? Maybe you might try and say a statement, a self-kindness statement, something like, this is really tough, but I'll get through it. And maybe there's a need that kind of comes to the surface. Maybe it's, gosh, I really need to take a break this evening. Maybe it's a bit of self-supportive touch. Maybe it's an action. Maybe it's, gosh, I really need to seek someone out and apologize to them. And if your eyes are closed, you can open them again. And that is the self-compassion break. Again, identifying mindfulness, what's going on in the present moment. Maybe repeating a phrase, I'm not alone, we all struggle. Then what is it that I need and how can I be kind to myself? And you can use this skill on the job, take a few moments. This doesn't have to be very long. It can be a couple seconds, it can be a minute, it can be as long as you or as short as you want. But this is a skill that you can use in times of distress where you're feeling overwhelmed and not sure what to do. You can use this skill as a way to kind of ground and know how to effectively respond to your situation. The next skill that I'll briefly go through is how to change that negative self-talk. So we've talked about the self-compassion break, which you can use kind of in the moment as a way to kind of ground and respond to the situation. And this is a way to kind of help curb some of those negative self-talk. And so I put a scenario up here. So recently, John has had trouble keeping up with his workload because of a pain flare that has lasted a week now. He was supposed to finish a project last week, but it is still unfinished. And he identified a very common thought that comes up for him in a lot of different situations, but it's come up certainly in this situation, which is that I am a failure. And so if you're willing, maybe identifying a thought for yourself, what floats up a lot, what is a thought that you notice quite often across lots of different situations. For John, it's this thought, I'm a failure. And so the first thing to do is just to identify your experience. Again, noticing emotions, sensations, or thoughts. For John, this was shame, pain, sadness. You noticed a fear, like, gosh, I'm afraid I might lose my job if I don't get this project done, or if I keep failing at things. And next, connect. And what I mean by this is it can be as simple as repeating a statement, "I'm not alone, it's normal to feel this way." But this can also scale up to maybe you talk to a trusted person, maybe you journal, maybe you make space for these emotions and get some support from other people. But again, it can be as simple as just repeating this statement, "I'm not alone, it's okay, it's normal to feel this way." And then lastly, being kind to yourself. And here you might identify a specific statement or change your perspective on your situation. And so for John, right, he has in the middle of a pain flare, and he has all of these work things, and not to mention in his life, all of these other to-dos have kind of fallen off the list, but he's still working on the project. It's much slower than he would have liked. But his reframe was, "I'm doing the best I can with the resources I have right now," which is true. And so being able to identify what it is that you're doing, and that you're doing your best. And that can be, again, as simple as changing that negative self-talk, reframing it. And then, something that I might encourage John and you all to do if it feels okay to do in these types of situations is maybe even identifying a response. Is there something you can do in this moment to help yourself? For John, it might be enlisting the help of a coworker, even though he feels some shame around that. Hey, can I, asking a coworker if they can help get him over the finish line. Maybe it means talking with his boss about, hey, can I have, one more week to finish this up? I'm in the middle of a pain flare. I'm doing the best I can. But at its core, like I said, just changing that negative self-talk again is going to reduce that secondary suffering, improve the physical stress response in the body. And I encourage you all to use this as well as the self-compassion break when it feels important and when it feels useful, and certainly when you notice those negative self-critical thoughts coming up. And so I'll talk a little bit in the last couple minutes here on things you can find if you want to learn more about self-compassion. There is actually right now, I encourage you to take a picture of this link as well if you're interested, but at Stanford, there's a call to compassion series going on. They had talks today and they'll last throughout the week by providers across the United States giving Zoom lectures. And so if you're interested in learning more about compassion, I encourage you to seek out this webinar series. There's also a number of treatments that use this, psychological treatments. There's mindful self-compassion, which was developed by Dr. Kristen Neff. There's acceptance and commitment therapy and mindfulness-based stress reduction. All of these treatments have strong components of self-compassion in them and have been used to treat a number of different concerns, pain, trauma, depression, anxiety, and have good evidence base for that. There's a number of books as well. I would certainly recommend Dr. Kristen Neff's book, Self-Compassion. This really changed the way I saw compassion. And she, again, is a pioneer in this area and talks a lot about parenting as well and her experiences with her child and how she's used self-compassion in that way. There's also Tara Brach, who introduces a lot of mindfulness in her work, but she also has self-compassion and gratitude practices. There's also John Kabat-Zinn, who developed MBSR and has this book, Full Catastrophe Living. His work actually focuses more on stress and pain and illness, and is a great introduction to mindfulness and self-compassion. And then The Gift of Imperfection, which is by Dr. Brene Brown. She really talks about embracing imperfection as a way of accepting ourselves. And she talks a lot about that contingencies around self-worth. And all of these folks have awesome TED Talks that you could Google on YouTube as well. And then lastly, a couple of podcasts. I had the opportunity to talk with Dr. Joe Tata on the Healing Pain podcast a while back for my work in self-compassion. So that would be a great place to start. There's the Science of Happiness, or 10% Happier. There's a number of mindfulness apps. The Curable app specifically is pain focused. The other ones here are mindfulness kind of broadly, but have gratitude and self-compassion worked into them. And then lastly, a couple of websites. The Center for Mindful Self-Compassion is also developed by Dr. Kristen Neff. And then there's some more tips and resources at positivepsychology.com on how to integrate more self-compassion into your daily life. And that's it. So this is my dog Zig. But thank you so much for the opportunity to talk with you all, and I'll stick around a little bit for the Q&A.